Hey everybody, I just wanted to go over the transverse model of the spinal cord inside of the vertebrae. If you notice, what you may notice right off the bat is that you have this spinal cord within this bony structure called the vertebrae. One of the things I suggest that you do is to really orient yourself which one is going to be the dorsal side and which one is going to be the ventral side. The best way of doing it is really looking at this spinous process. So the spinous process is always going to face dorsal or posterior or back. So if you see this here, then you know that this side of the spinal cord is going to be dorsal, and this area here toward from here to here is going to be anterior or ventral. So remember, anterior, ventral, and front. Remember, those are kind of the synonyms here. Posterior, dorsal, and back are also going to be synonyms here, right? Another trick is to really look for that dorsal root ganglion, which is 19, and because you see this bulge here, this whole area here is going to be the dorsal side. Okay, we'll come back to that in just a second, right? So I just want to show you guys the gray matter and the white matter here. So this structure here is going to be called the dorsal horn of the gray matter, and the white around here is actually going to be called the dorsal column of white matter. And this structure here is going to be called the lateral horn of the gray matter, and the white matter that is around here is going to be called the lateral column of white matter right here. And then this structure here, which is in the gray matter here, this will be obviously the anterior horn of the gray matter, and then this structure here would be the anterior column of the white matter, right? So just kind of keep those in mind, right? You also have the central canal, right, which we've talked about before, and then you also, from if you're looking here, this structure here is going to be called the dorsal root, and then if you look over here, this is going to be called the ventral root. So I don't know if you can see that. This is going to be called the ventral root. So ventral root, dorsal root, and then when they come together, you're going to have that spinal nerve, which is right here, right? So this model is a little bit clunkier than the other one, and of course we just talked about 19 would be that dorsal root ganglion, 18 would be that dorsal root, 17 here would be that ventral root. Okay. So the other structures here, if you look in yellow, that yellow is it's fat, but the space that's in it is really what we're looking for. This is called the epidural space, right? So this is your epidural space. And if we zoom in, this structure here, I think it's a 9, this is going to be your dura mater. And then if you look on the inside here, so I don't know if you can kind of see that here, this structure here would be the arachnoid matter, and this gray that sort of hugs the spinal cord would be the pia mater. So pia mater, arachnoid mater, dura mater, arachnoid matter, pia mater, arachnoid matter, pia mater. I mean dura mater. Oops, there you go. Right. And so where I have like my what is this? My probe. This space is called the subarachnoid space, and cerebrospinal fluid flows within this structure. So cerebrospinal fluid is here, and it's actually in the in the central canal as well. Okay. The dura mater, the arachnoid matter, and pia mater, all three of these refer to the meninges, right? So when we refer to the meninges, we're really referring to all of these three layers here. Okay? All right, so if you need any help with this, let me know. All right, bye.